So kind of before I get into a bunch of stuff, I want to comment on technology department as well. I did an interview recently with Politico, and they were talking about, kind of lessons learned. And the thing that we really talked about, and the thing they kind of wrote about us, was us being one-to-one K-12 before this started. We felt like that put us at a pretty good advantage because we were ready to make that switch. We didn't have to order a bunch of devices. But we have had to ship those devices out to kids because we were keeping them here. So the technology department has sent home unexpectedly well over 6,000 Chromebooks to our kids. We've had folks who don't have internet connection, so we've got over 150 hotspots out and about. And with that many devices out, not always being cared for in a great manner, things break. So, we've got a little service where you can make an appointment, you can pull up, you can honk. So we've had over 1,200 people come up and get help with their Chromebooks. And we have a helpline as well, and over 3,600 people have received assistance through the helpline. So, years ago, I started talking about with people this notion of how important it is to really look at data through multiple lenses. And yeah, I can't figure that thing out. Okay. Through multiple lenses. Because if we only look through one lens all the time, we only see one picture. But if we're able to look at it through multiple lenses, we can get a better picture overall. And that can help us tell a better story, better understand the story, and try to make a better decision going forward. The other thing that is really grounded in our work around continuous improvement is really something I heard years ago, and that is that we want to have better data this year than we had last year so that we can make better decisions this year than we made last year. So we've been collecting a lot of data, and we've been doing these little weekly videos. Hunter never knows what I'm going to do and what might fly across the room or what prop we might use. And I've got a few people that they're always wondering, so what are you going to do this week? What are you going to do this week? I don't know. So as we think about those lenses, and as we're going to look at some data here in a little bit, we really started out looking at things at the county level because that's all we had was county level data. And then we started the ability to be able to pull from the zip codes. And then that really enabled us to look at the community and the district in particular. And then when we brought kids back, the first groups in September, now we could look at the district a little bit more. And we could look at individual schools and what's happening within those schools. And we also know that we've gotten guidelines from all kinds of groups, right? Everybody's issued some kind of guidance. And if we go to some of the first guidance that was kind of out there, right, this Opening Up America plan that came from the White House, states never met the grading criteria before we started opening up. So even though we've had all of these guidelines, there's not been a great deal of attention paid to them. So we've got stuff from the CDC. That's changed. We've gotten guidance from county health. That's been all over the place. We paid attention, especially in August and the early part of the school year, to the stuff coming out of the Harvard Global Health Institute. And then we have the stuff coming out of the state as well. So we've kind of been trying to take all of these in concert. So if we look at those metrics, we also have a St. Louis County Education Task Force that's been meeting for months and months, who kind of educated us early on with healthcare professionals that these are the 4 metrics that we need to be paying the most attention to. And at that time, transmission rate, positivity rate, looking at the percent change in daily new cases, and the 7-day average. That's what we used in August, the last time we were on this stage at a board meeting, to make the decision to start the year in our connected model. We also look at the Harvard Global Health, which I mentioned, which is, they primarily look at the 7-day case rate. CDC ended up issuing a document where positivity rate, the 14-day sum, so now we're talking about a different measure, as well as how well districts and schools can implement mitigation strategies. So if we look at the Harvard piece, which is kind of what we used at the beginning of the year, as well as, which was the St. Louis Education Task Force, their metrics were kind of in line with this, right? Is that if you're in the red zone, you should be remote. When you get into the orange zone, you should start bringing elementary back, maybe middle school, but not high school yet. When you got in the yellow zone, you can start thinking about high school. The green zone is pretty much back to normal, right? We've never reached the green zone. I don't know if anybody's ever reached the green zone. So if we look at our data as of today, and we break it down into our different pieces, there we go. Our community, our high school, and middle school are all in the red zone. So if we use this lens and this lens only, we should not be here right now. We should be all at home, cowering in our closets, and we should all be in remote learning. If this is the only lens that we look through. Elementary is a little bit better based on this lens. If we look at the CDC lens, and they kind of have from a green zone to a red zone, right? So from the lowest risk to the highest risk. But here we implement these mitigation strategies. Many of them Dr. DeKemper talked about, right? Masking, social distancing, hand hygiene, cleaning, contact tracing, all of those things that we've really been concentrating on. So where are we? Well, our community's at the highest levels of transmission. So 200 puts us at the high. We're over 1,000, right? So we're really, really high. If we look at elementary, middle school, and high school, this CDC calculation is a sum over 14 days. We don't have the data to make that calculation. So if we use our 7 days, elementary and middle school are in that moderate risk category. High school's in the high risk. Positivity rate, elementary is looking awesome. Elementary positivity rates have been really good the whole time. High school been kind of back and forth. Actually, today's high school rate puts them in the lower risk category. But they spent the several days prior in that moderate risk category. And then on the mitigation strategies, we've never felt like we could put elementary all the way into all 5 correctly and consistently, because we're allowing kids to have snacks in the classroom so that they'll take their mask down, eat a little bit, put their mask back on. All right, we're unmasking at lunch. So we've not taken us all the way there. Middle school, the reason that we've kept them in the moderate and not put them in the lower is because we do have some classes with 16, 18 kids in there. So we're not fully meeting those social distancing pieces. We are doing it as best we can, but just because of the way a middle school schedule works and a high school schedule, for that matter, is going to work, it's going to be harder to balance out those grades. So one of the things that we track, going back to the St. Louis Education Task Force and those 4 things that we talked about back in August, is we look every week, every Wednesday, we look at what's been the trend over the last 7 days. Is it going up? Is it going down? Is it being stable? What's happened over the last 14 days for each of those metrics? And then at the end of the month, what's happened over this month for each of those? And of late, we've seen some stability in the numbers. Now, I mentioned all these groups that provide guidance. We know that all that guidance has changed. Some of those changes have been politically based. Some of those changes have been research-based. We know a lot more about the virus and its transmission than we did in March and April, when we were shutting down, and then the whole state shut down, and most states across the country shut down their schools. We also know that there have just been some convenience-based changes, right? If you look at guidance across the country, it's very different from state to state. If your state even issued guidance, Missouri is not. But Missouri changed the guidance on quarantines back in November, and if you listen to the argument that they made, it was a convenience-based argument, and that was, we're relaxing the quarantines so schools can actually have staff in their schools and not have to shut down. Was there a little bit of research behind it? Yeah, it looked like it, but they announced the way it came out, it was a convenience-based change. And then we've had some things that are a little bit more, kind of research-based, kind of data-informed as things have evolved. And that has led to incongruent guidance. So, if you look at the rules around quarantine, we got CDC rules that have been 14 days since the beginning. They recently changed that guidance, but still say that 14 days is the best case. As I mentioned, Department of Health and Senior Services, Missouri, if you're wearing a mask, you don't have to quarantine at all. That's the new Missouri guide. You have to have a mask mandate, though. And admittedly, the state will tell you it was a backdoor way to try to get mask mandates in schools. And then we have St. Louis County Health, which is sticking with the original CDC quarantine. So, Missouri got 114 counties doing 114 different things. That means the 500 plus school districts in Missouri are all over the map in what they're doing. Because all the county guidances are different. So let's look at the data. So we've been tracking a lot of data since March and April. And then as more data pieces became available, we've brought those into our mix as the year has gone on. So this is from the beginning. Right, the blue line represents the daily case rate, so it's all over the map. You can see that zeroing out kind of at the first part of September and then a big spike. That was a data system problem at the state level. And then you can see we calculated a 3-day average just to take a look at what was happening over a shorter day period, and the 7 and the 14. So you can see that we had a pretty big uptick in the couple, 2.5 weeks after Halloween. Mm-hmm. But since then, we've been relatively stable, even to declining. Another way to look at that is just take 14 days of cases in our zip codes and add them up. And every day, what's been happening the prior 14 days. And what we see is that about the 6th of October, cases started going up a little bit. But at Halloween, they skyrocketed. And we hit our peak around November 18th. And we've kind of been going down. People were expecting a Thanksgiving spike. We didn't see it in the community. One of the pieces of information that we get, we watch, we pay attention to, and a source of some of our data is a guy at St. Louis University. And now he puts out a little weekly deal. His report from yesterday, he is saying, we didn't see a Thanksgiving spike. We didn't think there was one. He doesn't think there was one. Transmission rates, we saw transmission rates very stable in that period when we started bringing kids back up until around a little bit before Halloween. We started seeing things going up. Again, that upward trend started about October 6th, and then the big spike around Halloween. But we have dropped off from our most recent high of 1.26. We were 1.08 for a couple of weeks, and now we're at 1.05. If we look at positivity rate within the county, again, we keep seeing the same story, and that is this upward tick in early October, followed by the big spike after Halloween, and a general trend line down since about November 18th and since Thanksgiving. So here on the positivity rates, anything above 10, not where we want to be. Our high on the positivity rates was November 12th at just over 22. And we'd like to be under 5, which is where elementary and middle school, and even now high school kids are below 5 on positivity rate. So we also look at positivity rate and the 7, 14, and 21-day trends. Remember earlier I showed you that graph where we look at it every week. So we just run the chart, we look at the trend line. What's the direction of the trend line? All right? Is it stable? Is it increasing? Is it decreasing? The percent change new cases, you know, I always go back and forth on this one, just because it is so erratic. Because every day you're looking at the prior 14 days, and you're looking at the first of those 7, comparing them to the second of those 7, and what's the change, right? So it's just all over the map. But here, when we look at it, we can see the spike at 4th of July, the beginning of the uptick in early October, and the increase after Halloween. Again, telling that same story, and then a decline afterwards. So if we look at just since Halloween, you can see that big up, and then we've been going down since then. If we look at the 7-day average of new cases, so this is the number that the Harvard Global Health Institute looks at, and we see what's happening there. We again see that same story of an uptick at Halloween, no significant spike at Thanksgiving, and that we've been relatively stable over the last week to 10 days. So you can see that here. You can see the relative stability of the trend lines in the 7 and 14-day looks, and you can see that the 21-day look, you know, when we get back closer to that peak time, then we start to see that downward trend. When we look at age bands. And we get the case rates for those. This is the county. We see the same story, the uptick after Halloween. So if we look at the positivity rates, again, we have all of our school age positivity rates are below 5 today. Elementary's always been below 5 since we've been tracking it. Middle school has been below 5 for quite some time. High school's been back and forth, but has been, it's the first time we've been there in a while. But we have been below 6 at the high school for about 8 days. So every 2 weeks, the county puts out a report, and part of that report is around youth cases in zip codes. So primarily, our zip codes are 25, 28, and 29. So we look at the youth cases and we compare them to the total number of cases in that same period in the 3 zip codes to kind of get a handle on what percent of the cases are coming from school-age kids. And, you know, early on, it was almost 20%. Almost 1 in 5 cases were school-age kids. But we've seen that drop week by week. And this most recent report has been our most favorable yet in terms of just youth and the percent of total cases. So overall, we're at about 15% of cases tend to be school-age kids. We also can pull from the state the cases within the boundaries of our district, right? So that's a little bit more limiting than the zip codes. And the state then breaks it down into generally what we consider elementary, middle, high school age ranges. You can see what those cases are here, and that in the most recent report, we've seen a decline among youth cases. So every Monday in the afternoon, we publish an update to our dashboard. And it gives information on the prior 7 days. So it's kind of a Monday to Sunday report. And so we publish that every week. You can click, you can see the data by school, but in the background, you know, we're tracking all that in spreadsheets too, to see what's happening over time. And last week was our lowest student case week since mid-October. And we had we had one of our lower weeks in the last 5 or 6 on the staff side. And you can see, you know, what's the percentage of kids that we're sending home, not letting them be on campus. So that's in the aggregate. If we break that down by how many of those are elementary, how many of those are middle school, and how many of those are high school, we can see what's been happening there as well. And we can also break that down to the school level. And when you look at it at the school building level, you begin to ask interesting questions around why have some schools had such a high case rate? Is there something going on within not the school, but that neighborhood around the school that may be causing those cases to be a little bit higher than in some other places. And one of the things that anecdotally we think that we see is that more affluent parents tend to have their kids in more activities, and we were seeing cases being transmitted among those out-of-school activities, whereas our less affluent schools, those kids do not typically participate in those kinds of activities, and perhaps we were seeing some lower case numbers there. We can also look at the number of students that we've quarantined, right? We don't quarantine. Dr. Bressler talked about that. We can only say you can't come on campus. So you can see what those numbers have been across the district through last Sunday. So if we look at those student quarantines over the time period that we've been in session, right, the bulk of those, just barely, have been contact traced to on-campus exposure. But if we were to go back to a previous slide and you took out that massive week of quarantines at Washington Middle, it's going to even out a little bit more, right? So if we look at student positive cases, since we brought students back, we've had just over 200 positive cases through Sunday. Through contact tracing, nearly 90% of those are from off-campus exposure. So if we look at what we've been able to identify, we think, as on-campus exposure and the unknown exposure compared to quarantines, then, you know, it's around 1% or less of students who get quarantined end up testing positive. Anecdotally, we hear a similar percentage from other districts. And that's part of the reason that the state reduced the quarantine guidelines, is that anecdotally, that's what they were hearing. On the staff side, we can see where we are there and where we've been week by week. We can also see what our staff's quarantine piece is, right? Those people that we require to be off campus. This doesn't include those folks who just hit on a screener in the morning and may not be able to come in. But if you think about these numbers and you think that that's the number for the week and a quarantine is for 14 days, then oftentimes you're capturing 2 weeks of numbers. If you go back then to the data that Jennifer Hansen presented and what we ran into in that third week of high school being here were high quarantines, and our sub rate one day was below 50%. That's what led to the closures of the high school, that we could not make school work in the staffing model that we had. Thankfully, looks like we're going to have 25 new subs before we get to the semester, and we've been working on bumping up staffing a little bit for second semester, which we believe will help out in that regard. So if we look at staff quarantines, the staff quarantines, the bulk of these have been traced to off-campus exposure. And if we look at our positive cases, again, right at that just under 90% have been from off-campus exposure. So we can look at that drilled down lens of what's happening within our schools. But if we zoom back out and we look at what's happening around districts around the county, what are their learning platforms for elementary, middle, and high? We can see that at the elementary, most districts now are in either 4 or 5 days a week at the elementary level. We're in that 4 districts that are in some sort of hybrid, blended, staggered schedule model. And we still have some districts in the county that are fully virtual at elementary. And then there's 4 districts that aren't reporting anything in a way that we can really understand and discern exactly what they're doing. At the middle school level, most are in some type of hybrid. Most districts are in some type of hybrid at the middle school as they are at the high school. And when we talk regionally, which is once a week, there is a widespread desire by everyone to get kids into more in-person opportunities. I mean, that's a conversation nearly every week, and how people are doing that. And what we really find when we talk to districts, and we all talk among one another, is there seem to be 3 factors that tend to influence what districts are able to do. One is the manner in which they're delivering some sort of virtual instruction to their families. And how they set that up has impacted staffing and what they can deliver on a daily basis. And some have done it in a way that they don't think they're really struggling to get out of a hybrid model or a blended model. Others, or one of the second piece that has impacted a lot of people, really ties to what have your class sizes historically been? And based on your class sizes, how does that impact social distancing in classrooms across your district? Well, we tend to be at the MSIP minimum, not the desirable. The lower your class sizes, the easier it is to socially distance. In some respects, you could also add, kind of as a side note to that, size of classrooms, which kind of goes to when buildings are built and how big those classrooms were. Because if you go back in time, schools weren't built for social distancing. They were built for efficiency. We want to jam as many kids in a room as we can because we don't want to spend as much money on a building as maybe we should. The third piece is kind of related to the second piece, because when we were all back in July and August and we were trying to figure out our blended models and our connected models and how all that was going to work and how you were going to support the child care needs of employees in order to bring people back and all of that. We're having all of these conversations and everybody's asking everybody else, how are you able to do that? They would say, well, we're using this part of our staffing. And my answer oftentimes to them was, yeah, we don't have those people here. We don't have that set of employees like you have. So how you staffed, what your class sizes were at the beginning, and how you set up your standalone virtual program has played an impact into what people have been able to do. And that's influenced some decision making on the part of people. So if we look at that age band data again, and we compare St. Louis County to two of our surrounding counties. So St. Charles County, they're all in 5 days a week, have been since the beginning. Wentzville had to shut down their high school for a little bit when their sub-fill rate was in the low 50s. But you can see that St. Charles typically has had a higher school-age case rate than us. They've been able to make things work. It's been a challenge. They quarantine a lot of kids. You know, I always take quarantine with a little bit of air quotes. And schools in Jefferson County are kind of all over the map. Some are hybrid, some are full, 5 days a week. So overall, I mean, our observations have kind of been this consistently. When we talk to other districts, one of the things that's related to that virtual program is we've got a lower percentage than a lot of the other districts that are in our virtual program. We've been at about 19. You saw the numbers earlier at middle school, high school, and elementary level. But other districts report 25, 30, 40. Some districts started out with 65% of their kids in their virtual program. One district, one of our neighboring districts, is reporting that 50% of their kids will be virtual the second semester. So they're actually seeing an increase for second semester. We also, from our internal data and anecdotally talking to other people, is that the mitigation strategies seem to be keeping on-campus transmission low. And in a meeting 2 weeks ago, Washington University physicians were talking about some research that they were just completing, suggesting that kids in school are at lower risk than those in the community. But as you've heard multiple times, that really the notion of workforce sustainability is the number one issue that's caused closures for districts. Whether that's been 14 days and open back up, or shutting down a single classroom, or maybe a school building. For some, it has been entire districts. But in early November, when the state changed that quarantine guidance, and most counties adopted that, that really relieved the pressure on them. Not all counties adopted that, but most did. And the other thing that's interesting is, and it's an observation that I've made, it's an observation that one of the physicians at WashU who's consulted with a lot of districts, he and I have had this conversation, that case rates among kids really doesn't seem to matter based on what model you're in. That one model doesn't drive you one way or another. So if you look at districts kind of across the region and whether they're fully in person, they're in, you know, some kids are full-time, others are hybrid, everybody's virtual. And what's happening in the 14 days prior to each of those, no matter what you were doing almost, you saw a decline after Thanksgiving. However, 2 of the 3 virtual districts went up. Most of the ones that are full-time went down. Maybe all, or stayed relatively stable. So the question every day is, what guidance do we use? If we follow the Harvard Global Health, like I said earlier, we should be under stay-at-home orders and remote learning for everybody. Through that lens and that lens only. If we look at the CDC, our communities at the highest risk for transmission. High schools are somewhere between lower and higher. Middle schools are in that moderate, and elementary are low to moderate. The WashU research suggests that kids are safer at school. And our internal data is telling us that exposures are leading to these quarantines, but the quarantines rarely result in positive cases. And then there's a lot of stuff we just don't know. We don't know if somebody's going to change the guidance again. I'm guessing they will at some point. We don't know for sure what the vaccine timeline and window for school employees is. Dr. DeKemper mentioned we think the end of January, first part of February. I talked with our lead nurse, Jen Ahern, yesterday, and we were talking about rollout of that and whether or not we're going to be able to get those providers that help us with our employees and giving them flu shots on campus. Are we going to be able to get them on campus to do these vaccines as well? As of today, we think probably not. And, you know, what's going to be any new guidance around vaccines and masks? Doesn't look like that's changing as of right now, nor does it look like vaccines and quarantines may change. So in a meeting earlier this week, the conversation really was we may not see a big change in what's happening in districts based on the vaccines because we don't expect changes in guidance. So with all of that, right, what is our end goal? Our end goal is to like be here all the time with no masks and no social distancing, right? And to be at some level of normalcy. However, we have learned some things through all of this that people have said we should keep doing that into the future. The way we had to change one particular thing, that seemed to work really well. Let's keep that practice. But the question is, when might this happen? When can we get to this? So I ask, what can you rationalize? Well, if you look through one lens and follow some, you can rationalize being fully remote. Or you can look through another lens and say that we should be fully in person because others are making it work. Or you could say it could be some combination thereof. So it comes down to decisions, decisions, decisions. And where do you land? So if we think about today being December 17th, and that, you know, we're roughly going to be here. We got 3 more days of school before the break, and then kids will return on January 5th. That's a long ways out. We've refrained, or tried to refrain, from making decisions that far out in advance. So as of today, we don't see any immediate changes for what we're currently doing on January 5th. Looking beyond that, January 19th is the start of the second semester. We think that once we come back and we're able to see another 20 plus days of data, that we'll be able to make a better decision on January 8th about what might be possible for the second semester. And if we make a decision on the 8th, essentially we'll be able to give people about 11 days notice of any change. And what we would hope to do at semester is to get high school back to the blended and hope that we can get elementary to 5 days a week. So what we hope we can do, we'll see where the data leads us over the next few weeks and see if we can actually make that work. So I know that was a lot. It's been a lot. I'm lucky because every day I get to work with all these people that talked before me, and they are very skilled at what they do. We are very fortunate to have them. So I just get to come in and talk about numbers because, you know, I was a math person, so numbers work for me. So with that, I will try to answer any questions that you might have.
I'll just say this was a great, fantastic information, very thorough, and very good to hear, and how grateful I am for everyone who's coming together to help our district during this time, because just sitting here tonight, it's exhausting, and we're just sitting here. We're just listening to a presentation. So I can't imagine how exhausted you all must be, and I'm just very thankful.
Well, I know I play around with this data every week, and I think your point about the granularity and the lenses is critical.
Yeah.
Because when you look at it one way, it tells you one thing, a broader concept. It's a multi-level story. And I think the information and the examples you've given show us that.
I agree. I think we need to just keep our community, first and foremost, of course, using the guidelines that we're given that we have to follow. But just a couple of facts startled me tonight. I was just shocked about number one being that only 1% of the people quarantined actually come down positive. That just seems like a big waste of manpower and student learning.
We've had a lot of conversations about that among the superintendents and in the state and physicians, and on the one side it's, oh my gosh, we're doing all of this quarantining and we're not seeing the positive cases. Is that a waste? On the other side of it is doing these quarantines helping keep transmission low in schools? So what's the trade-off there? And the other thing is, we talk about all of this different guidance from all of these places, and people want us to follow the guidance that gets them to where they want to be.
Yeah.
Right?
Sure.
And we've tried consistently to say that we're following the guidance of county health. They are the most local health authority that oversees us. And then I joke, if I was ever going to apply for a job anywhere again, I think I could add to my resume that I'm Assistant Director of Health for St. Louis County Health Department some days. I think we can all do that. A colleague mentioned, he's like, I think I stopped being a superintendent in March, and I've just been a public health official ever since.
Or a statistician.
Yeah.
So I'm a meteorologist on snow days, so hey.
Yeah.
I've got one question, which everything you showed us with student transmission rates and all of that, it's very good through the right lenses of where we could be back in school full-time. If we go back in school full-time, we do get the larger class sizes, the three considerations you said before. A couple of those our district tends to be on the wrong side of.
Yeah.
So we've talked about it. Social distancing, 6 feet isn't going to be feasible in a lot of places for that, which doesn't necessarily end that, so long as parents understand that for their kids and accept that. But teacher safety comes into it because teachers aren't high school age anymore. They've gone through college and they're at an age where this can be more impactful. So how do we make sure, as we're going down these roads, that we're figuring out how to keep teachers safe?
So I think we've got a couple of things in play. One is Mehlville at home. So many of our teachers who maybe have health conditions are teaching in Mehlville at home. So we've got that piece. We do have some, I'm not going to say concern, maybe worry. It'll cause a massive puzzle again. Figuring out the staffing around Mehlville at home based on how many kids are there, what grade levels they're in, what buildings they're in, how many kids that leaves in an existing building at a grade level, that really impacts staffing. So if we make any announcement, that's going to play with that. So we may have teachers that we may have to move. in any given direction. What we've seen from districts that are back full-time with, larger class sizes is how they shape those classrooms and what are the classroom procedures that you see. And what we see a lot of is this notion of pods or cohorts within a classroom that stay together throughout the day, right? We're going to sit together. So if it's the three of you in a pod, then you're going to sit. You're not going to social distance during the day. You're going to go to recess. You're going to play together. You're going to eat together in the cafeteria. But this pod over here is going to be 6 feet away from you, and they're going to stick together, right? So that's partly a piece of that. The antigen test that we'll be doing now for possible exposures that are off campus, or if folks are showing symptoms, that'll help us keep people in and out too.
As part of that, then, if kids are able to be closer together, being able to keep the teacher further away from the kids?
Yeah, we've got a number of teachers, that were middle school, high school, elementary, that are keeping, have set up things in their classrooms to make sure that they keep a distance from kids. And we also have teachers that in order to feel like they're really helping their kids, they're going to be right there with them. And, I was talking to a teacher earlier this week, and she's like, you know what? I still have my little reading groups at my table. She's like, but we're only there for 5 minutes. She's like, we're there. We hit something really quickly, and then we break up. So people are being very mindful of what they have to do. One of the things that we've learned kind of longer that we've been in is that people have come to understand a little bit better how they need to modify how they interact with people during the day to try to minimize maybe having to be quarantined or that I'm exposed or whatever. I mean, and we've been learning that. We've been witnessing that, through the contact since June when we first started doing that. And then as more people came back, it's like every new group that came back had to learn it on their own. It's kind of one of those things that, they didn't learn from the mistakes of others sometimes. Sometimes you have to experience things yourselves. But again, especially with staff, most of our exposures are off campus.
Okay. Thanks. Any other questions?
If we start trying to move towards 5 days, are we going to start doing the same rollout scenario like we did bringing them in for blended?
I don't think so. I think we'll just stick with
Just
elementary.
just at the K through 5 and then,
It'll be all elementary all at once.
okay.
Because to go 5 days,
It's sort of blended at that point.
logistically, it becomes too much of a challenge on the special side to not take them all. And this is actually a conversation we had with the elementary principals back in October, because we had gotten really close to bringing them back in October, and
And then the numbers started going up.
they did. So we backed away, but we had the conversation with the principals and our return to school committee, and it was that they felt like we needed to go to 5 days, we needed to take everybody at K-5 at once. Because logistically with the special teachers and how some of them were part-time or supporting Mehlville at home as well, that it would just be logistically easier to do them all at once. All K-5 at once, not K-12.
I mean, if we did go 5 days, would we start making offerings to people at home saying, hey, if we're going to go in 5 days, do you want to make that change?
So Dr. Bressler can speak to this a lot better than I can. I'll just put it this way. We ask everybody to make a hard commitment. We have not held anybody to that commitment. we have tried to be very accommodating and allow people to move back and forth. And so far, we've been able to accommodate everybody that's asked. Did I say that right?
I couldn't say it better than
I can say it in fewer words, though.